Good afternoon, everybody, and a very warm welcome back to a nice, cool room. Well done for braving the elements earlier. Apologies for the rain. We can sort lots of things, but the big man or woman upstairs wasn't having any of it. But I hope you get the opportunity to have an ice cream. So our second de-risking panel, first one of the afternoon, is all about de-risking partnerships. And Illumina is a major player in this area. We've got obviously huge activity taking place, particularly in this region with the new sequencing centre, and obviously on a global scale, the 100,000 Genome Project, hugely important. And so I'm delighted that the Vice President of Illumina, Geoff Smith, is joining us this afternoon to chair this next session. So without further ado, over to you, Geoff. Thank you.
Thank you, and it's a real pleasure to be here. I've been working for Illumina for over 10 years. I came from the Selexa acquisition, so very much on the technical side of things. And over the last 10 years, I suppose, been involved in an awful lot of different partnerships and obviously a lot of data sharing. And very pleased to be chairing this session today. So I think it's fair to say that forming effective partnerships and sharing data has been something that's got Illumina to be where it is today. We've done it well, and it's been very much a focus. And it's also something which is going to be very much part of what we do in the future. Now, I'm going to say, before you all get nervous, I don't have any slides. Okay, so until you're waiting for the next slide, I'm just going to give a few perspectives before handing over to the speakers. Now, the importance of partnerships, I really want to encapsulate for Illumina in something which is one of our company values. And you might think, well, that's a very strange and slightly American place to start. And the company value has now been abbreviated, and actually it's lost something, I think, in its abbreviation. And the full company value was this, that deep collaboration allows us to compete in ways that others cannot. And I thought that was fantastic, because there's two parts to that that really resonated with me, and has been something that we have really striven for. One is a deep collaboration, not something that's superficial, something where both parties are actually doing real work together. And the second thing is that through that deep collaboration, you can have competitive advantage. And I think that's something that's also resonated with me, and certainly something that's been very important to us. And of course, we've done this with not just a lot of different customers, vendors, other organizations. But this has been something that's really, encapsulated part of what we do. Some of the depth there has really made those collaborations very much peer-to-peer rather than vendor and customer. And certainly here at the Wellcome Trust, Sanger, and also places like Broad, we have certainly felt part of their team, and they have felt part of our team in the level of with which data is shared between the two groups. And certainly, whilst we think we're experts in what we do, there's nothing like actually selling customers expensive instruments and getting them to run a huge number of experiments, and for them to then report back to you what they find, and to then have to go through all of that together and then see what there is that we've missed in our product development. So that's been extremely fruitful for us. And what that's allowed us to do really is de-risk a very rapid cycle of change and innovation to customers, because we've been sharing information and data with them very early on. And for them, they get the latest technology way ahead of the herd, which is obviously for them very competitive in the academic space as well. Now there's, as I say, a huge number of different examples I could use, but I just wanted to choose three different sort of perspectives, I suppose, as to the way that we've done different partnerships, and I'm really looking forward to hearing what the panel's view on this is as well. So we have the traditional partnership route with CDAs, and then everything within a CDA can be shared, kind of, and we've obviously done lots of those types of partnerships. Some of the others which have actually been very fruitful have been where there's just been a piece of effectively peer-to-peer academic work that's gone on between ourselves and an academic group, and there was one in particular that I was involved with here in Cambridge, where we published, must be over a period of 2 years, about 6 or 7 peer-reviewed papers in some of the top academic journals, and there was no written agreement between us at all. It was pure common interest and feeling that we needed to get on with this and not actually have any barriers in our way. Now, you can't obviously do that across the board, but there was an example where that really worked. And then on the flip side of that, we in California have set up an accelerator. So this is like an incubator for small companies. And the reason why that's very different is we have very hard and fast firewalls between that startup company and the rest of Illumina, because we want them to stay independent. We are just providing the facilities and resources to get them going. So what I'm trying to say is we've had to apply different models for different situations, and I don't think one size fits all. So I'll turn to the panel, and really pleased that such a broad spectrum of speakers, from big pharma to academia, with biotech and a public-private partnership in there as well. They provide a contrast to my own sort of medtech in inverted commas world, though I think our world is certainly turning more big data by the second. So we got 2 talks in the pharmaceutical space, Jenny Laird from Lilly and Neil Martin from Mission, and then to look at big data sets, we've got Geoff Barrett from the Centre for Therapeutic Target Validation, which is based here, I believe, on the Wellcome Trust campus. And then representing the earliest stage of the innovation cycle, if you will, Simon Cook from the Baber Institute, again, very local to everyone here. So we're going to hear from all 4 speakers, and then we'll assemble around the chairs. We might need an extra chair. And then we'll take questions from the audience. So first up is Neil Martin from Mission. He's VP of Research and Mission Therapeutics, and having led a successful career at Kudos, and his title is Converting Grand Ideas into Practical Collaborations. So thanks, Neil.